Hey, good afternoon and good morning. I'd like to welcome you to today's webinar. The title of our webinar today is Critical Connections, the Nuts and Bolts of Developing State and Community Relationships that Support Equitable Services for All Young Children and Families. So we begin today's discussion recognizing the need for well-aligned systems and the urgency of bridging the divide between the needs of marginalized children and families, and on the dearth of solutions that adequately serve those needs. So we believe that well-developed state and community connections can help accomplish these goals. And so I'm Ngozi Lawal from the Center for the Study of Social Policy and also hub support to Pritzker Children Initiative States and Communities. And so I will be co-facilitating this discussion with our very good friend, Karen Ponder from the BUILD Initiative. And we have two presenters, Kendra Dunn and Rachel from Michigan, who will speak and provide some personal accounts of what's happening in their states. So I want to just go over some housekeeping that I think could help everybody, since this is not the usual Zoom webinar that we're accustomed to. We'll be able to hear from the presenters. Sometimes in other formats we'll unmute, but since there's so many folks participating, which we're really excited about, we are going to ask you to just use the chat feature and if you're having any technical challenges, and also use the Q&A box to ask questions of the presenters. We will have some space at the end for their responses. So we hope that that's the way that we can communicate, again, since we have such a large group of participants. So I am going to turn it over to Karen Ponder, who is going to talk a little bit about the nuts and bolts document, just to talk about where it's been and where it is now. And Karen will then introduce our presenters. I just want to raise that everyone by now should have received some materials regarding the nuts and bolts document. It's the full document and also some highlights, just pulling out some of the key principles and concepts. So that's what we'll be working from today. So if you haven't had a chance to look at it just yet, we'll be providing a really high level overview of the document and hope that it is useful to you. We will also take some questions from the chat box. And then also we appreciate that some of you were able to send forward some questions that you, yes, Sonia, we will post, we can post the information in the chat. Just give us a couple seconds to get Karen on and then we'll work on that request. Thank you for raising that. Some of you sent forward questions regarding what's a burning issue for you in your state or your community. And so we were able to pull some of those questions and hope to get to those today. We do only have an hour, so we'll try to get through the conversation as efficiently as possible. But we really do hope that this is the beginning of a conversation. And especially in times like these where we're all trying to recover from the pandemic and all the challenges that it's created. We're all coming together and thinking about how we can leverage each other's knowledge and expertise, whether you're at the state level or whether you're at the community level. And that's really the spirit of this conversation.
Just try the old version of Nuts and Bolts, which was published in January of 2014, but was based on research with 12 different states that Karen and Jerry had interviewed that had done a lot of state to local initiative system building and sort of cultivated a lot of lessons learned. And before the pandemic, as the pandemic was emerging, we had started revising the nuts and bolts to sort of hold up some of the cleaner best practices that were emerging. So if you've seen the old version of nuts and bolts, that's the one on the left. The one on the right is the new version that we will make sure you get the link for that today. And as well as the one-page sort of cut down handout that has the key highlights from that document. So that is where we are, sort of where this is all pulling from. And there have been a lot of interviews with a lot of states, and Karen herself has been working very extensively with a lot of states over many years and has watched how these systems have evolved. And that's why Rachel and Kendra are here to speak to some of their experiences within that. Also, this might be a good time just to mention, and we will have a slide on this later, but there is an upcoming podcast that I know Rachel was already interviewed and has one. But if you're interested in this topic of state and local connectivity, Karen is doing a 6-part podcast where she's going to go deeper dives into 6 different states. And I know Rachel in Michigan will be one of them. Episode 2, I believe. I think North Carolina's first. And so there will be a follow-up. We will send everyone who's registered for this webinar, we'll get an email. And just to note, the name of that will be Critical Connections. We are sort of moving away. Nuts and Bolts doesn't sort of speak to what it's about. And we're talking about the critical connections for children and families to thrive. So then if you see the words critical connections, they are very linked to the Nuts and Bolts document, but the podcast is coming out under a slightly different brand title. So, oh, and there she is.
Awesome.
There she is. She's back. So Karen, I stole your thunder a little bit and I sort of gave this background of these 2 documents already. So the where Nuts and Bolts came from and sort of the updated version. So you can sort of pick up from there.
Perfect. And hello, everybody. This is kind of like systems work. It's confusing. It doesn't always work the way you planned it to, but that's why we're talking today. And I'm so delighted to be with you. And I wish I could see you all, but at the moment I can't. So I just wanted to say that the creating statewide early childhood systems that include formal connections between the state and local communities actually began in the early 90s and certainly continues to date. There are a couple of states that I'm actually working with that are just getting ready to, one is thinking about a system of state and local coalitions, and then the other is actually launching theirs. And every state that's created this kind of infrastructure has taken a slightly different approach to the work, but there are commonalities among all of them. And certainly there's no perfect model. If you've worked in state systems work, you know that's true. Each state system has evolved over time and changed with the changing world, and that should continue. So in 2013, and Gretchen may have mentioned this, but Jerry Cobb, who was my former colleague in North Carolina Smart Start, and then our colleague at Build, and as you know, our colleague at the Pritzker Foundation now, but she and I decided to review the work of states that had been taking this state and local approach for a while, and just to learn how they were getting along and what they were learning. And we chose states that had a statewide coverage and were taking a comprehensive approach, and most importantly, had developed county or regional coalitions that had a formal relationship with the state. In other words, we wanted to learn how early childhood systems were working when the state and local communities were linked together in their approach and in their work. And as a result, we wrote the first document, which you have already seen, and then the document looked at each state's overall mission and vision, the state and local governance and funding and staffing, technical assistance, accountability, advocacy, all the things that make a system work. And I would say none of those can be left out. They can be done in different ways, but there are certain things that we've seen that make a system work or let it just kind of winnow away. We also learned, though, that there were some major accomplishments and challenges, and we compiled the lessons learned for states that were considering this kind of partnership between the state and community. So a couple of years ago, we started thinking about how to revise that, and you saw the revised version that Gretchen and I have been working on. And we hope that pulling out the principles and the lessons learned from states in a more succinct way will be helpful as you do your work and think about what's next. So all of this underscores the importance of formal connections and building partnerships between the state and local communities. And it isn't quick nor easy work, and Nuts and Bolts actually documents much of what is needed, as you'll see. because the early childhood system is made up of so many systems within systems, as you know, and state and local policies, there are often bureaucratic mazes for families to move through that can make it almost impossible for them to get access to the services they need. This is exactly why states and communities must communicate, and I'm talking two-way communication, and build a seamless and cross-sector approach to reach children and families. While states taught us many lessons, there were 8 that stood out and that almost every state talked about to us in different ways. And you will see those 8 key lessons from states that have aligned state and local systems in the handout and also in the new document. Today, we're delighted to be joined by key leaders from 2 of the states that we actually wrote about in Nuts and Bolts, and they will share with you their important lessons and give you examples of how that has worked in their state. Kendra Dunn is from Colorado and Rachel Pritchard is from Michigan. Kendra is the director of the Division of Community and Family Support in the Colorado Office of Early Childhood. And among many other responsibilities, Kendra supports her state's community coalitions that are part of a statewide system within the state. And then Rachel is the Great Start Program Specialist in the Michigan Department of Education. Rachel started her work actually on behalf of Michigan's children and families as a parent. She came into the program as a parent herself and then led her own county's Great Start Parent Coalition. Rachel oversees the work of multiple programs and initiatives, including the Great Start Collaboratives and the Great Start Parent Coalitions. So thank you for joining us today, Rachel. And if you will kick us off by sharing a little bit of your personal story that really relates to being an engaged parent in a state system in Michigan.
Sure. Hi, everyone. So as Karen said, my name is Rachel Pritchard. I started working in early childhood, as Karen mentioned, as a parent. I was asked to sit on our local Great Start Collaborative as a parent, as a mom of 2 who had children at home visiting at the time. And so I did that role for a short time. And then our parent liaison was leaving, that was overseas, the parent coalition. And I was asked to step into that role. And I led our parent coalition, started it and led it for a few years, did some technical. This work really is so important to me, just knowing my children were so young when I started. They were 3 and 4, and now I have one going off to college and another a senior in high school, and seeing some things that have changed over those years and have gotten better for families, but then also seeing things that haven't changed. And that's why I'm still in the work, is that I want to see families not have to go through some of the same things that my family went through and other families that I've worked with, whether it was at the local level or now at the state level. I want to make sure that there aren't those systems issues that are happening for families. So thank you for letting me join you today and share a little bit more about Michigan.
So Kendra, how about telling us some of the things that you have been involved in, and particularly how they relate to some of the lessons that we've learned from all states?
Kendra, you are on mute.
Of course, thank you. I think we just want to start by saying that every state is different, and this work is slow and it can be hard. We've been on this journey for at least a couple of decades. And so I just want to say that, you know, as we share our remarks, we don't necessarily want people to think, hey, be like Colorado, but we are hoping that there maybe are some lessons learned that could be applicable along the way. And certainly we hope to pick some of those up from other states as well. So I want to start really quick by just giving you a little bit of Colorado context because it's important. Colorado is a county administered state supervised state, which means, sorry, you can advance the slide, which means that we are a local control state. And it's very much baked into our Western rugged individualism type of culture. So there is no work in Colorado unless you're doing it locally. So with that being said, there's 3 key anchors in our system I'm going to touch on briefly. And by no means does that mean those are all of our partners. County departments, families, nonprofits, and our early childhood providers are essential. But I wanted to talk a little bit about the key roles that these entities play in our connections. So the first one is our Early Childhood Leadership Commission. It is our state advisory council on early childhood and care. And it came into being in statute in 2010. The Office of Early Childhood was then created out of some of the work that that group did in 2013. And what it did was it consolidated programs that were supporting families with young children, prenatal to 8, in one place. And so I called out to say that the Office of Early Childhood really has a whole child, whole family focus. It includes our early intervention, IDEA Part C, our early childhood mental health consultation, our home visiting programs, our family resource centers, and a suite of child maltreatment prevention programs. And so bringing that office together, I will be honest, it took a good 5 years for us to get some coordination across the breadth of that programming. And I will tell you, there's still a lot of opportunity for us to get to alignment, especially around things like data systems, which is proved to be enormously time-consuming and hard. And then our early childhood councils really they were established in 1997, so they actually predate the other two, but they really are our local systems builders. We have 34 councils that cover 64 counties. And in addition, they have a statewide membership organization that strengthens their collective impact at the state level and works with the state. And they really act as our kind of fundamental way to engage in planning and local decision making, and for them to feed information from their local systems back into our planning and decision making. They also are a critical partner in how we cultivate leadership in the state, both for providers, for families, for partners, and for advocates. And I just want to point out here, one of the things we've learned over time is that this local infrastructure through the councils, it has greater longevity than our state administration. So as we change leaders and governors and public officials, what stays is really that local sustainability through those councils. And to give you a little bit of a human side of it, our councils during COVID really ended up being a key network that allowed us to respond to needs quickly. So I'll give 2 examples. One, we heard within probably 2 weeks of March 2020 from families that they were having a very hard time getting baby supplies, diapers, wipes, and formula. We actually were able to secure a FEMA order for those items, but needed a way to get those materials to families. And so we partnered with our early childhood councils, and they had local partnerships with their family resource centers. And we were able to distribute 2 million items very quickly within, about a month statewide for those items, which was great. At the same time, the early childhood councils were being called on by early childhood providers and for cleaning supplies and for items that they needed to keep their centers and family care homes open. And so again, there was a coalition that was built among businesses and foundations to purchase those supplies using the early childhood councils as their point to really be able to distribute those materials. If you want to go to the next slide, I want to highlight, I'm trying to go fast because I know we're a little late, but in 2008, we used an early childhood comprehensive systems grant to create an early childhood Colorado framework. And then we went ahead and revised it in 2015. Both times, hundreds of voices were included in work groups and feedback sessions, parents and providers. And this document, this framework, I really want to kind of highlight the importance of really getting to that, to having a shared vision and shared outcomes, because it's definitely the thing that has reinforced our whole child, whole family approach, because it includes early care and learning, but also health and mental health and family support. It has outcomes related to access, quality, and equity. And so it's really brought some order into out of the chaos, brought order from the chaos for Colorado in terms of a shared direction for state government, county government, local communities, nonprofit providers, our foundation community, our advocates, and our researchers. And so it's just been an essential document that is now actually taking us into our next steps. Well, I'll get to quickly. If next slide, I will just say that around data, how to share outcomes, how to share data. One of the lessons learned in Colorado, the Colorado Department of Human Services for a number of years used a performance management system called CSTAT, which allowed us to establish wildly important goals and then really work together to accomplish them. And so we would establish a goal, and then monthly we would meet with senior leadership and look at the data and do continuous quality improvement. It was a venue to not only use our thought partners in senior leadership, but it often resulted in us going and getting more feedback from families and providers and partners about to make meaning out of that data and understand what was going on and how to craft new strategies to meet those goals. And so this is just an example of a slide that we worked on. It was a very difficult process, but I think what we learned was the real value of having these shared conversations across people. What we found is we didn't always measure the right thing. And in fact, over time, we changed some of our measures and started looking at other things. But the process of really doing data-driven decision-making together was a really good discipline. In addition, within our early childhood system, we use a lot of independent program evaluation to also give us a sense of impact, especially around our community and family support programs that don't have quite as large sets of administrative data the way our early learning programs do. And in addition, our Early Childhood Leadership Commission hosts a standing data committee. And so they are constantly mining the field for research and for data that can be shared across our early childhood system. Next slide. I was going to give an example of, and there's so much to mine here, we are in the middle of our Preschool Development Grant, which has really been an opportunity to do something with the lessons learned during our Race to the Top grant. We have created a new 5-year plan that goes through 2025. The work is very expansive across the system. There's over 50 strategies, so I couldn't clearly share it all with you, but some examples that really kind of get to this whole child piece. We have an initiative building universal design into several childcare settings. We've developed several new workforce pathways. We have worked specifically on local collaborations between our early childhood councils and our family support providers like family resource centers and home visiting programs. And we're in the process of lifting a brand new online parent hub that can really act as the front door to our entire early childhood system, whether families need to find childcare or learn about what's to be expected from a 2-year-old, or they need food or housing or a parenting class. And so we're working we're excited about the Parent Hub. The other thing that's coming out of our this work, and it's kind of an important one, which is through the years, we've done a lot of stakeholder and parent engagement. that has mostly been through things like surveys and town halls and focus groups, but we are finally in the process. August will be our first meeting of building a standing family voice council for the Office of Early Childhood. And we're just really excited about that opportunity to do that in addition to the other things we don't believe that should take the place of, but we really feel like investing in parent leadership and really infusing that voice in all that we do is an important step of taking on a greater equity lens in our work. The other thing I want to say about Colorado that I think is really important, if it's not true in all places, is that we really lean into public-private partnerships in all the work that we do. And so what that means is we have close relationships with the foundations. They sit on our Early Childhood Leadership Commission, as do several businesses. In addition, our research and academic community is close, as is our advocacy community, because we recognize that the state government isn't always the appropriate or most effective messenger for many of the things we're trying to accomplish. And so we really spend a lot of time cultivating those relationships to ensure that we have champions outside of our early childhood professionals that are helping us drive the work to really get to the point where children are healthy, valued, and thriving. And you know, a good example of how we use that extended network, we just did a huge round of stakeholder engagement to really guide decision-making on how to invest the federal stimulus funds coming through CRSA and ARPA. And then the next slide. Excitedly, we have a new journey we're about to go on in Colorado. We will have a new Department of Early Childhood in July of 2022. So we have a year to lean into even further consolidation and also lifting universal preschool starting fall of 2023. So we're kind of back at the beginning, I think, with our learning hats on, trying to figure out how to integrate what we've learned. I would just share two takeaways from the past couple decades. One, sustainability is built through relationships. I think we've learned that things are never so institutionalized or embedded that relationships won't matter. And so really putting time and effort into continuously cultivating those relationships is important, and that requires consistent communication. So one of the things our ECLC lifted a couple years ago was a shared online newsletter that is open to all stakeholders to share all of their information. And it's released monthly, but what's nice is it's not owned by any one place. It's really a place to see consolidated information across the system, kind of shortcuts things for people. And then I will just say the work is never done. I think right at the beginning, someone kind of mentioned that, I think it's Rachel, that she was going to stick at it until we help families navigate systems more easily. And I could not agree more. So we are in the process of engaging our stakeholders to help us inform these big two things we're about to do. And with that, I hope I went fast enough. I'm going to go ahead and cede my time.
Thank you so much, Kendra. And you have a question or two that we'll get to a little bit later. But Rachel, we want to hear from you about some of your important lessons learned.
Absolutely, thanks. And just to reiterate some things that Kendra said that are also true of Michigan, we are also local control. So our school districts that oversee or are the fiduciaries for our Great Start Collaboratives and parent coalitions, it is a local control state. So we do provide guidance for them at the state level in some requirements, but then they also, the good thing about them is that then they use their local control and their local data to really tell us at the state level what is going on, what needs to be worked on for children and families. So we provide them some guidance again, and then they use their local data to really say, here's how it looks for us in our community. We have 54 Great Start Collaboratives in 61 parent coalitions. That math obviously doesn't work out because there are some collaboratives that are multiple counties together, but their parent coalitions might be separate. So for those who don't know what those are, either our Great Start Collaboratives are our local early childhood systems building bodies locally that are either one county or multiple counties, and they work again at that local level. They have a sister body, which is made up of parents and caregivers of children prenatal through age 8 that are all volunteers, and they work together to work on those pieces locally that are important for children and families who are navigating the system. And another thing that Kendra said that stuck with me, that is something I think that's really important, is that relationships are key. We cannot move the needle and move the system forward on transactional relationships. This has to be authentic, real relationships that are built over time, over trust, especially when we're talking about working with providers and families that live in our communities. And so looking at those core principles that are in the nuts and bolts document, in that the summary document, and obviously the larger one, having that family and caregiver voice is so important. And so it leads me to really that 8th key lesson, which I think is one of the more important ones, because scale up and sustainability is so important. Starting smaller and working up is what we did in Michigan. We started with 21 Great Start Collaboratives, then we built to 54, which is covering the whole state, in order to make sure that we had a sustainable path forward. We used some public and private dollars, which is always good, because there's public dollars can kind of ebb and flow with administrations or with the state of your budget line items for those. So really having that state or the federal, or sorry, public-private connection is key. But we can't do a lot of the other things that are really important unless we have that sustainability, especially when it comes to engaging at the local level. So while it's really important to have someone, again, I think Kendra mentioned this early in her piece, it's really great to have someone like me or like Kendra at the state level. It's more important to have those local level people really driving the work and making sure that they have the funding available for that. So one of the lessons that we've learned is that having the right amount of staff is really important. And as Karen mentioned earlier, I oversee the Great Start Collaboratives and Parent Coalitions, and that is a lot for one person. When we think about our local levels, having one person who's not, who their sole focus isn't on their collaborative or their parent coalition, also makes that very difficult. So even for us in Michigan, we've been doing this work for a while now. Sustainability and in terms of financial support, and also those staffing levels, are something that we're still trying to work out, so that we can make sure we have good oversight to make sure we're using those dollars correctly, but even more importantly, that we have money to support families that are participating and engaging in the system. So whether they're sitting at our local collaborative table providing parent voice, or whether they're engaging and they have programs that are part of the system that they can engage with in order to make their child's life more successful. So really finding that funding piece and making sure that you have adequate staffing at every level is so important. It's also important to have quality technical assistance and support. Again, one person can't do it all. So you really need to find who are those experts in your community or across your state or across the country to be able to provide technical assistance and support to the local level. So they know what's the next best thing we should be doing. How should we be engaging families differently that we didn't do a couple of years ago? Or how do we do our strategic plan? Because we can have all the strategic plans we want at the state, but that's for everyone. What does that look like locally? How does your local data make changes in those priorities? Something might be priority number 3 at the state level, but locally it might be priority number 1 for you, because that's what your data is telling you, is that that's the thing that's really important for your families and for children to be successful. So having technical assistance and really knowing who are those leaders. Even if it isn't right in their local community, it might be, in the other part of the state, it might be in another part of the country. That's so important for the work to move forward. And it's also important for public education and advocacy. So if you have the funding in place and all your people are there, you have staff, you're getting technical assistance so the staff feel supported and they know they're doing the right thing, then you have to look at your community and really start getting them involved. Look at your elected officials, whether it's at your city council level, whether it is at the county level or at the state level. How do you let them know that this work is important? Early childhood may be something they're not familiar with before they get put on the committee for early childhood at the state level, or the importance of non-smoking in public parks where children are going might not be something that a local city council person or a township coordinator knows a lot about. They need to know who are the people we can contact, and getting out your information about, here's the local early childhood leaders. They're this Great Start Collaborative, or they're your early learning council people, is so important, so that when they have questions, they're not just thinking and making up answers on the spot. They're going to those people that are local leaders. And making sure that we have families present is always, always key. If you look at your core principles, when you look at your nuts and bolts, those top 3 principles about communities and families and providers, I can't overstate that enough, that is so important, is that we have families available and providing their expertise about what it's like. Even if a program doesn't necessarily want to hear that they may not be doing the best thing or may not be having an offering at the best time, in order for us to move forward, we really do need to have those family voices at the table, sharing those expertise and having that be valued. And so in Michigan, we support families financially that way. If you sit on a subcommittee of our Great Start Collaboratives, or you sit at the larger body, the larger collaborative body, you are paid a stipend to be there. Everyone else is paid to be there for their expertise, and we feel families should be paid to be there as well. So we give them a stipend and help them with barriers as well, if that's what is needed for them to provide that expertise at the table. So I think I might have covered everything. Hopefully I didn't talk too fast. Just trying to make sure we have enough time for questions.
Thank you so much, Rachel. And also Karen, for just sharing what's happened, the way that the work has been unfolding in your state. We don't have a lot of time, so I'm trying to be really strategic about questions that have come in. I'm just pulling from some of the questions that came in advance, and a theme that's been coming up, or that came up, is equitable community engagement, and how, so I guess some advice around how to reach and listen to folks that we don't typically hear from. And so Kendra and Rachel, in both of your remarks, you talked about, as an example, the importance of family engagement. So I think that's one aspect of it. And so I'd like to combine this question of how to reach and listen to folks you don't typically hear from, and combine that with another point that you made, Kendra, which is around, next year, Colorado's going to be, launching its new Department of Children and Families. I'm not sure the name of it, but it's your early childhood cabinet level agency. And in some ways, it sounds like, you've had your local early learning councils for almost 20 years now. And so you have a lot of experience doing this state and community connections work in early childhood. But there's new work to do because this new agency is getting off the ground. So it feels a little bit cyclical. And it feels like, even though you have a lot of experience in this, you are starting new. So let me just try and put the two questions together. You're starting new, and this work is cyclical. And so as you get moving, as the state gets moving, and getting this new cabinet level agency off the ground, how do you make sure that you are reaching and listening to the folks that you don't typically hear from? Even if you're doing a terrific job with engaging parents, what are those other stakeholders that need to be involved? And how might you go about trying to just broaden the scope to make sure that there truly is full community and state engagement?
I think this is a great question. I have two things that come off the top of my head. The first one is so obvious, but truthfully, I don't think we did it well until we got our Preschool Development Grant, which is to truthfully translate and provide interpretation and really lean into language justice. I think has been a really important piece of hearing from people that we didn't used to hear from. You know, we kind of were in a pattern of doing things in English and Spanish, which hit a lot of people, but we really were missing some communities that not only were underrepresented, but were also experiencing some of the most important disparities in terms of access to services for their children. And so that's an obvious one, but I think it's important, and I don't think there's any, I've come to the opinion that there's no way around it. Like you absolutely just have to figure out how to lean in. And then the second thing I will just say, in Colorado, I think one of those partners that we maybe haven't engaged quite as strongly as we should or could going forward is our county departments of human services. So we have engaged them in terms of CCAP, our subsidy program, but not really fully embraced the idea that county departments of human services are also the touch points for economic security programs for our families, and often are the pathway to SNAP or other resources. We know that food insecurity is a huge issue in our state, especially during COVID, and that it is one of the indicators that really show great disparities across race and ethnicity. And so I personally, as we think about a new department, and especially because we'll be a department of early childhood that doesn't have a companion county level state government or county government, that need to really understand how to develop new relationships with county public health and county human services is going to be really essential.
Thank you, Kendra. Rachel, would you like to add to that?
Yeah, I would say Kendra's right on. Some of the same things I would say too is look to where those trusted messengers are, those trusted people in each community. And similar to technical assistance, one person can't be the all in all for everyone. So really finding those people who are keyed into other people that you want to bring in and talk to, and be honest with why you want them there. And say, I can't say I speak for everybody's perspective. And so if I want to talk with somebody or a group of people, would definitely say you hold a perspective that I don't hold. And it's hard for me to understand how all children are impacted by this and all families are when I don't see that perspective. So I need your perspective at the table. And so just being honest that the experiences that they're living, everybody's experiences are different and all experiences are needed at the table. In finding, if there's not one person, finding that entity. It might be a food bank, it might be a translation or a refugee center where there's someone that family trusts, that if that person invites them to the table or comes to the table with them, they're more likely to speak their voice and their experience, rather than if you send them an email and just say, hey, come to this meeting. I mean, we all get so many emails, we all get so many flyers. It's really that personal connection and having somebody who's already trusted by them, invite them to your space and making that space welcome to them. Like that can't be undershadowed either. You can invite people all you want, but if they're not feeling welcome when they get there with the people already at the table, they'll never come back to the table. So we need to make sure that they're invited by someone they trust, that someone is there to support them, and that those of us who are already at the table make that space welcome for them.
Thank you so much, Rachel.
Mm-hmm.
So I think we have time for one more question. Gretchen or Chloe, do you have a question to queue up?
I am here. I think I think some of this was already answered about how you're motivating parents to participate. So I think we can kind of skip through that one. But one question that was raised that I think was new is how are your states and community connections helping you coordinate with how you're planning to spend the ARPA dollars, the New American Discovery Plan dollars? So if either of you could sort of speak to that, I think that's something that's a real hot button issue right now for a lot of people.
I can't speak to as much about the ARPA as I could actually about that previous question. So I'll see if Kendra has anything to add to that.
Sure. I will say, it's a really challenging time because with stakeholder engagement, often you want to go slow so that you really can hear from lots of different people. And there are lots of deadlines associated with these funding streams and submitting funding plans, which not need to go back to the feds, but first need to go through our governor's office. So we mobilized very quickly to do a large number of focus groups and town halls. And then we did a survey that was pretty well had lots of responses, is what I'm trying to say, to come up with our initial funding plan. The good news for us is that we have been kind of cascading them in terms of getting spending authority from our legislature. So the good news is it wasn't a one-time, we went through it and we decided every funding stream. So we went through a process with CARES, and then we went through a process with CURSA, and we're just now kind of starting our ARPA funds. The good news is we also had a ton of research at our disposal when we got to ARPA from everything we had learned as we were aggregating stakeholder responses during CARES and CURSA. So we tried very much to take it and say, here to scaffold and say, here's some of the things we've heard. Are these still a need? Are these a priority? What else have you heard? To kind of help people have something to respond to. But I will just say that is a challenge. Our biggest challenge, I think, is that many of these funding streams have very specific restrictions, and there are different restrictions for each one of these streams of funding. And our general stakeholder community, families, the general public, even our providers, don't necessarily understand all of those. And so I think there's this excitement that there's this huge windfall of money, and isn't this great? And yet we are more limited than we would want to be in terms of our ability to fund innovation or fund, ongoing services that we don't think we can sustain, or that would supplant existing state funding on things. And so I would just say, yeah, stakeholder engagement is really important, but I think we're also learning that communication around kind of the expectations and limitations are also important, so that stakeholders can engage without frustration about we're not doing what they want us to be doing with the money.
Thank you, Kendra. So in the interest of time, I just want to thank all of you, Karen, Kendra, and Rachel, for such an important conversation today. We really appreciate the history, Karen, that you, actually Karen and Gretchen provided on the nuts and bolts document, and then Kendra and Rachel on the events that have unfolded in your states, and just all the wonderful insights that you've provided, insights and advice. So let me just take a moment to say that one of the most important things you can do is to continue this conversation, and you can do that by signing up for the NCIT Exchange. Here's a quick screenshot of the website. I am just going to drop really quickly, in case you're not already signed up, the link into the chat box here, just so you have it. And then also, oh, that's if it will paste. It won't, but I'll keep talking. I'll get it in. And then also, you can continue the conversation by going to the exchange. That link will be posted. Thank you, Chloe. And then also you can receive all of the materials that were presented today, whether it's this PowerPoint, whether you're looking for the nuts and bolts document that we keep referring to. We also have a one-pager that summarizes the document and gives you the highlights. That is also available. So you can get all of those things from the NCIT Exchange site. And then also in your emails, you should have received, and I believe you'll also get a follow-up email, some more information that will get you directly to these documents, the PowerPoint and the nuts and bolts document, the one pager. And then finally, if you are super eager, the links were also dropped in the chat box during the conversation. So you should be able to receive the information from today. And we also want you to stay tuned for our upcoming Critical Connections podcast. And that will dive deeper into specific states' journeys with just setting up the state and community infrastructure. So it's a way to continue this conversation. You will receive an email. So if you've registered for this webinar, you will get an email when this launches. And our lovely Karen Ponder will be facilitating the conversations, and Rachel will be in conversation number 2. So we're really excited about that. So thank you so much for participating today. We really appreciate all the really important questions that you submitted, and we look forward to continuing this conversation with you. Have a lovely rest of the morning and or afternoon. Take care.